And we're recording. Excellent. All right. Well, thank you, everybody, for tuning in and watching. And for those who are listening, thanks for listening. So today I have a friend on as my guest, somebody who's also one of my main mentors in human movement. And I'm talking about, she's the creator of the EBFA course content. That's the Evidence-Based Fitness Academy, and Naboso Barefoot Technology. And of course, I'm talking about my friend, Dr. Emily Splichal. Welcome back. How are you?
I'm doing amazing. Hi to everybody who is tuning in. It's been a while since we had done one of these conversations. So
it has been a while. Yeah. In fact, the last one was, I love all of them, but the last one was the mindset for success.
Yeah.
About a month after the Barefoot Summit 2018 in your office. So I'll put a link to that on here, and I'll tell you, you got some great stuff to share about success. That was so much fun.
Thank you.
Excellent. Well, so we kind of have a mission here, a plan. We were going to talk about a couple of things. Now, I'm very sorry to hear that you were stricken with the COVID-19 virus, but I know that you're on the mend, you're doing better, and I wondered if you would mind sharing a little bit about that experience, because I don't know too many, well, not here, probably in New York, there are people who know people who had it, because you're so densely hit there. What was it like for you, if you take us from the beginning to how you're doing now?
Sure, yeah. So thank you for allowing me to do that. I know that here in New York, which is where I'm based, I live in the financial district with my family, and I actually know quite a few people who have gone through COVID, probably 25 to 30 people within like a tight circle who have gone through it. But when I speak to some other people in other states in different areas, most of them are like, yeah, I don't know anyone, like you're the only person, or I know one other person. So it's hard to have an understanding of how it presents, and there's a curiosity of what it's like to go through it. So I'll just tell you a little bit about kind of how my symptoms, so that people can be aware for themselves. Is my symptoms all started very GI. So it was nausea, diarrhea, loss of appetite. That's really the first day. And then I was like, oh, that's weird. I don't know. And then the next day it progressed to being like weakness in my arms, that I felt like clumsy when I was typing on the computer. I was trying to fold and do some orders, and it was just very kind of like clumsy. And I was like, what is happening? Like, it's very weird that I'm noticing this clumsiness of my hands. And then next day got a little bit of a headache, still the diarrhea and the clumsiness with the hands. It wasn't until day 4 that I was driving to Connecticut anyway to do something away from my family, and I started getting chest pain and a little shortness of breath, and I'm like, all my assumptions were, I was like, I don't know, am I getting sick? Is this somatic? Do I think I'm getting sick? And then I'm like, it just kind of gets in your head. But then when that started happening, I was like, okay, I'm actually going to stay here away from my family, because now it's presenting like that. So that's day 4-ish. Then that night, for the first time, I had a little bit of trouble breathing, just kind of like you couldn't do a whole breath like that. And that was interesting. I'm like, okay. And then the next day I felt fine. And I was like, oh, maybe it's nothing. So I thought, no problems. I got a vitamin C infusion just to kind of squash it if I did have it. Feeling great. That night, little bit of shortness of breath, nothing crazy. Sunday night, little bit more. We fast forward now, I'm day 8, and it was very like this, where you think like, I'm past it, and then you're like, shit, it's back. And then, right, it kind of waxes and wanes in how it presents. Day 8 night, it was like 12:30. I had severe chest pain, and I couldn't inhale. Like I just inhaled all my entire lungs, right? I couldn't inhale more than like 2 or 3 seconds. And then that was it. It was like cut off. And I was like, oh my God. So I'm like up, I freak out. I'm by myself with my dog. And I'm like, oh my, like I'm just freaking out, because I've never had that sensation. I felt like I was drowning. So I called 911, the ambulance came, they tested my O2 sat, listened to my lungs, monitored me for a little bit. And then just said, essentially, yes, you're having shortness of breath, but there's nothing that we can do on the scale of how everyone else is. Like, we wouldn't vent you at this point. We wouldn't do that. Like, she just got to like ride it out and keep monitoring and call us again if anything else happens, which is very unsettling. So I had to go back up to the apartment with that ability to only take a little bit of an inhale. So I didn't sleep that night, clearly. And the next day I then spoke to my doctor, was able to get a steroid inhaler, and then started getting on that regimen. So it took several more days to kind of be like, okay, now I can breathe a little bit more relaxed. But I would say a good week, five to 7 days, that I did not have full ability to do an inhale and an exhale. I started sleeping sitting up. I started doing some postural drainages and treated it like pneumonia, essentially, at home, and then felt fine. But now what started happening, my breathing was getting normalized. What started happening is I started getting severe brain fog, dangerous brain fog, that I would, was running to a doctor appointment, driving, and I heard a noise, and I was like, is my dog in the car? Like, I thought I had brought my dog, and I didn't know if my dog, like, it was like when you're losing your mind and you
right.
lose your mind. It was very scary, and quite dangerous, as far as I was scared to drive home to New York then. I felt like I was really just like 25% of my mental capacity from a memory recall and the quickness of, being able to do public speaking that I do. Like, I just couldn't come up with phrases. For any of the women who are listening, if you hear of like mommy brain, and after you have a baby, you like lose your brain for a little bit, same thing.
Okay.
After I worked with my daughter, I was like, I couldn't connect phrases. I totally forgot words, which is part of pregnancy, and they studied. It was the same thing. And I was like, oh my gosh. So everyone has their opinions on things to do. I have a massive regimen of what I am doing, but what I started doing is IV ozone. The reason that I sought out IV ozone is that I came back to my family and I started getting GI symptoms again. And then one night I started feeling chest pain a little bit, a little sore throat. Again, you're like, is this somatic? Like, is this in my head, or am I starting to... And then you read about people who say that they're getting these relapses and reinfected. And what they're thinking is happening is that you haven't completely cleared the virus. So then, right, the viral load goes down, and then whenever maybe you get lax on your vitamins, maybe get a little complacent, and then your immune system starts to go down a little bit, and then the virus sees this opportunity to kind of start upticking again, and then you show symptoms again. So you self-reinfect.
Okay.
Or it might be mutating within you, and then you reinfect yourself with a different variation of that virus. Regardless of what it was, I was like, I need to fully clear myself of this virus, and I had known ozone. I'd listened to a lot of research on ozone before, on how ozone was used with Ebola virus. It's used with HIV, it's used with SARS, it's used with Epstein-Barr, and many different viruses. And so I sought out a doctor that does it here in New York. I've done 3 sessions. Today was my 3rd session. And what they think is that the COVID dropped my immune system and my T cells to a point that anything that's opportunistic, yeast infections, right? Candidiasis, herpes, meaning like cold sores, Epstein-Barr, which is technically a form of a herpes virus, they are opportunistic and they can essentially resurface. If you think of like shingles is again an opportunistic virus that's going to come out when your immune system drops to a certain point. So whichever it is, if it was COVID has a direct effect on it, or it's this opportunistic, or it's just inflammation in my body, or it is just neurotoxin, whatever it is, I want to squash it. And now day 3 is the first time that I actually feel reconnected to my body and to my brain, and I can think clearer. So yeah, it's definitely been a journey. It's been now roughly 4 weeks of just low grade shittiness, which is just like, I don't want this to be my new normal and just be like, these are the remnants effects of what people think they should now be recalibrated against. I want to be where I was way before this. And I know that some of it is stress because I am extremely stressed out with this situation. Everyone to some level, I think, is. But there's just a lot of vibrational anxiety in New York City because of us being the epicenter.
I'm sure. Yeah, I can only imagine what it might be like. I've seen, on the news, they show pictures of Times Square and this and that, and there's nobody there hardly, and it's just not how it is. They're going down the streets in the village and there's nobody there. Yeah. Yeah, it's a whole different thing, man. Wow. So this has been going on now, you said over 4 weeks?
Yeah, I'm going on the 4th week where I had subtle symptoms, peak of symptoms, no symptoms, minus the brain fog. And then this week I've actually been tackling brain fog. So
Okay.
yes, 4 weeks.
Okay. Wow. And your family, I know your family's okay, right? Rose and everybody.
Yep.
Okay.
Yeah, my husband and my baby are, which
Okay.
the isolation side is very important, which is why I made sure that I left my family. But my husband is doing all of the vitamin regimens that I'm doing just to keep his immune system up and his inflammation level down. So you want to boost the immune system, lower inflammation so that you're kind of, when you get it, you can attack it without getting like a high viral load or a high cytokine storm that they speak about.
Right. So let me ask you this. I'm curious because I was talking with a friend of mine who's a doctor in South Carolina a few days ago, and he's actually heavily into the COVID research right now. He was mentioning that there tends to be a lot of inflammation that comes along with this. And did you experience that?
Yeah, so that's when you look at the research, they're showing the cytokine storm is around interleukin 6, which is a specific inflammatory cytokine or marker. That yes, the inflammation is, but it's specifically that one that classically is rising. So there are various vitamins and things like that specifically reduce interleukin 6, right? Which is the specific one. But yeah, so I would say most of my inflammation would be gut and then brain. And that connection is so important where people who look at gut-brain axis and probiotics. So what everyone is speaking about is also like you have to protect your gut to protect your immune system, to protect your brain. And if my inflammation went sky high because of the infection, then my gut just became leaky and now my brain is leaky. And then things can get in that you don't want in.
Yeah, I mean, leaky brain is an actual thing that a lot of people are unaware of. I didn't even know about it until a couple of years ago. But that whole gut-brain connection is, in my world of, movement disorders and all that, we know a lot of times, not to get off track because I'll come back, but the disease can live in the gut for 10, 15, 20 years before it manifests any symptoms eventually here. But inflammation of the brain is a thing. It's an actual thing, or it can be. Leaky brain syndrome, I never heard about it a couple of years ago. I couldn't believe it, but it all makes sense. And I'm glad you brought that up because I think it's a really important point, especially taking care of the gut, feeding yourself well.
Yeah.
And taking the right supplements too, the probiotics and whatever regimen. Do you mind sharing your regimen?
Sure. I mean, half of it's over here and I have so many that hopefully I can keep track of it. But yeah, so the probiotic is really important. The doctor that I'm doing the ozone with, he recommends Doctor's Biome. It's a specific probiotic. There are various different probiotics. I've never been a fan of, like, you get what you pay for when it comes to vitamins.
Yeah.
So make sure that you're getting the highest quality one because they're not FDA regulated. So the bioavailability of different vitamins varies. Doctor's Biome happens to be one that was recommended. I use a lot of Bio Optimizers. It's a company that makes very good magnesium, probiotics, and a couple other enzyme-based supplements. But some of the other stuff that I'm taking is, of course, vitamin C. the vitamin C that I did this regimen, and then the doctor with the ozone just reconfirmed that regimen, is that I take 1,000 milligrams every 2 hours. So versus like just a high dose once, you want to actually like split it out. So you want to keep like a constant level in your system of whatever it is that you're taking. So I take 1,000 milligrams every 2 hours, vitamin C. I take L-lysine. So L-lysine, for those that aren't familiar with it, it's an amino acid, and it actually shows antiviral properties. So it's used for herpes simplex, the cold sores, is that if you feel a cold sore coming on, they recommend taking L-lysine. It squashes it. You essentially put it back into its remission in a sense.
Okay.
So I take that. L-glutamine, which is another amino acid, is also an immune regulator. Take that. Krill oil is an omega that crosses the blood-brain barrier, where a lot of other omegas don't have as high of permeability to the blood-brain barrier. Turmeric and curcumin also crosses the blood-brain barrier, and it's a very good anti-inflammatory. Magnesium is incredible for your mitochondria and your immune system, and sleep, which is also very good. I just started integrating this because I've been doing research, but chaga mushroom has very high vitamin C and other anti-inflammatories. Carbon 60 is it's a nanoparticle that's antiviral as well. And then astragalus is antiviral. That's an herb.
Yep.
Olive leaf extract is anti-inflammatory. I'm taking that. Of course, D3, I'm taking that. And when you take D3, they actually recommend taking vitamin A. So I take those together. And I think that is, yeah, that's it. And then 3 liters of water a day.
Great. Good. Yeah, that's great information. But I'm glad you're starting to feel better anyways, because it must have been kind of scary too, huh?
Yeah, because you
the
just
breathing
don't know.
thing, chest pain and breathing is, I've never had either of those. I wouldn't want to either.
Yeah, I've never wanted to have like a broken leg instead. I'm like, I just wish I had like a broken arm or a broken leg and was in severe pain from that. Like that, you can kind of like, conceptualize a little bit more. The whole not being able to breathe was, I mean, that shit's scary. And after that, I was like, I don't want anyone to experience this, any loved one, anyone who's listening, anyone. It's very scary because you can't control that. And it's something that can change so suddenly. And that's what's scary about it.
Yeah, right. Did you experience any loss of sense of smell?
No.
Okay.
But that's where they're saying that.
Of course, but I know everyone's different how they're affected with anything, but that's another one I hear can be a first sign, but it's a fast diminishment too. It's not like it takes a year. It happens in a day or two. But
yes.
Yeah.
Yep. And that's where they're showing that it has neuro effects. Is it actually, so what is it doing to the nervous system, showing that you lose your smell and your taste? So they're kind of showing that. And then there was some research around the neurological effects of how it affects breathing, because your breathing is regulated also from a neurological standpoint. Is that potentially how some people get such sudden changes in their ability to breathe, that it's actually not just this CO2, O2 kind of harmony, and it's not like there's fibrosis in the lungs, it's something more the neurological side of how breathing mechanisms are controlled. It's interesting. I think we're obviously going to learn a lot about the virus moving forward.
I think so. But I really appreciate you sharing your experience, and we'll have to check in down the road and see how it goes from here on out too for you. So let's move along. Let's talk about other stuff you're doing, because you're always doing things. I love, you have a headquarters now for Naboso right in one of the boroughs. Is it
Brooklyn?
Brooklyn? Right. That's great. And how's that business going, and what's going on there?
Yeah, so we are actually doing a rebrand right now, which is the perfect time to do it. But we have a really exciting rebrand as far as the packaging. The logo's getting kind of a facelift. Our website is getting a facelift. Same quality of products. So it's not like we're discontinuing products, that we have the same quality of products. They're going to have a slightly different look, which I can't disclose yet. There's going to be colors involved with this.
Oh, nice.
Yes. And then we are launching an even more stimulating insole. So we have 1.5, the Neuro right now. And then we're doing a step higher. And that's actually the insole that we're putting through the FDA process. So that insole will go through the FDA approval for neuropathy.
Oh, good.
Yes,
That's really good. That's really good. And for anyone who, if they're not familiar with Dr. Emily or anything she's been doing, because I met you, actually it's going to be 6 years ago this summer, when I came to your office and very nervously interviewed you. I went to the interview the other day, I'm like, oh man, Carl, holy crap. Still not a professional interviewer, but I was pretty uptight the first year I did that. Anyways, Evidence-Based Fitness Academy as an education curriculum, which I used to teach for, and I miss doing that. It's such great, groundbreaking, relevant information for all humans, right? For walking, we need to know about it because it's been great for everybody I work with. Let's talk about that for a minute. With live workshops being a thing that's not happening, I'm assuming it's for any of us, what's going on in the education area? Do you have any plans there? Because you have online stuff too. You have online programs in education.
Yep. So actually most of our content switched online and now sits on Teachable. So we have a Teachable platform or a Teachable school. ebfaglobal.teachable.com, and then that's where we now have our courses. We just added a really good foot and ankle course. It's a 6-hour course that sits on that platform, and we're doing one on movement disorders that you'd really appreciate, going into dystonia and things like that.
Oh, good, good.
That sits on the platform, and then our BTS level 1 is online. And we'll get back into the rhythm of the live after COVID. But in the meantime, we have, courses, we have webinars, we have our blog, we have our YouTube channel. I have my book, Barefoot Strong, which is print and Kindle. And I'm writing, and I will resume writing once I get my brain clear, a second book, actually it's my third book, that is about owning your health.
Oh, good.
And the big thing around that is about self-advocacy. I feel that people need to be larger advocates for themselves and understand what they can do through exercises or supplements or diet or stress or whatever it is, to just know that, it's your body. And if something is recommended to you by a doctor, you still have every right to question the appropriateness of that recommendation. And a lot of people don't do that. They just think, oh, the doctor said I need surgery, so therefore I'm going to have surgery. Where it's like, there's a bias that comes into medicine and people don't realize that. And I don't want to make it like this is a whole like controversial or conspiracy theory thing. But I'm trying to help people understand that there is a bias, or there's always other alternatives that could be done in that sense. I bring that from how I approach my patients. It's how I approach my philosophy whenever I've been a patient. And then hopefully through that combination of experiences and then the education to educate the individual, that they feel more empowered when they do interact with a doctor and get a diagnosis. Neuropathy, which is one of the main conditions I see in my office, a lot of people will essentially see a neurologist, hear that they have neuropathy, they're given a pain medication that has tons of side effects like Lyrica, pregabalin, gabapentin, Neurontin. Those are two of them, but different names of them. And then they're just kind of like, period. So it's just like, my name is Emily, I have neuropathy, nice to meet you. Like that is essentially, that's it. So live with it. Versus, no, you can You can increase nerve growth factor by taking certain supplements. You can do, infrared. You could do light therapy. You can do balance exercises. You could do proprioceptive. You could do vibratory. You could do it. You could, like, a whole slew of things that you can do. There's CBD. There's, that a lot of patients shouldn't just be like, I have a diagnosis and therefore that's it.
Yeah. I don't mind that you said that. This is a platform for you to say whatever you want, but I will also jump on and say, my son says the same thing, and he is a doctor. He's down in Atlanta, ER, and I see it everywhere I go. I've traveled, but spent a lot of time with people in the medical world, and my favorite people are the people like you and my son who are thinking outside of the box and trying to look at the body in a more holistic, because we are a system, as a friend of mine calls us, a squishy bag of systems that chemical reactions and things. Everything's connected to everything else.
Yep.
There's so many ways to approach things. So that's one of the things I've always loved about what you do is you're not going to go slice and dice if you don't have to. Maybe we can do some short foot and we can correct that issue down there or up here or whatever. There's so many different ways to approach that I'm glad you're doing this book. Glad you're writing it, and let me know when it's done so I can push it for you, because this is the kind of stuff we got to get out there as mainstream thinking one day,
Unfortunately, a lot of that stuff, the more that, any of the professionals listening try to say, no, I can improve your balance. I can reduce your falls. I can help you, feel your feet more, or whatever it is, that you will start to get attacked a little bit because it isn't mainstream.
Oh, it's true.
Get yourself up for the ability to be attacked on that. So the more you go, the fish swimming the other direction, the more you have to have like armor in a sense.
Yeah.
Where you have to be able to bounce off some of the haters because you're swimming in the other direction, but you just have to keep swimming in the other direction. I've had that for like 12 years. Since I graduated podiatry school, I've been sent hate mail and, whatever.
Yeah, I know you have too. And then, I guess it's just part of what you have to deal with when you're really forging your own path. And I think the fact that you've not only stuck to it, you're one of the, what do they call, you're forging the path ahead, because people are starting, they've been for a long time, but more and more and more people are starting to jump onto that path and realize, oh, you know what, there's something here. I've had my own degree of it, but I'm not going to stop what I'm doing.
Yeah.
And what I feel is right based on, I had a doctor the other day, he's a doctor, he's 90 something years old, look at the insoles and say, I don't know about that. Puts him in the shoes. I can't believe it. But to get him in the shoes took forever. And I explained the science behind it. Because, they don't learn that stuff in medical school. Yeah. And he was an MD in internal medicine. They don't know about all those things. And they're not wrong because they don't, but awareness is going to help a lot.
Yeah. Yeah, no, I agree. So and then understanding the people who take the moment to truly understand what you're saying are also the ones that you kind of want to have that open to, where some people will see the before and after videos that you post on Parkinson's that we're like super grateful for, and has like really opened a whole new avenue for Naboso. So thank you for those. They'll say, oh, so you're saying you cure Parkinson's with these insoles? And I'm like, what? Who said that? Nowhere did we ever say that, right? That all we're doing is helping people connect to the skin in the bottom of the feet, which stimulates the somatosensory cortex, which plays a role with how you maintain balance and gait. That's it. You take them out, I don't know, maybe their gait goes back to it. Sure, mate. Right? So it's just interesting to see that people will jump to an association that they think you're implying, but you actually never said that.
Oh yeah, well that's a whole other area of the brain and thought processes, I guess. But I think the thing that kind of, one thing happened that bothered me, not, maybe about a year ago, as I was showing some of those videos from Mexico, especially, to a neurologist. And he's just looking, it's like, nice, looks placebo to me. Oh man, I think if I just put any kind of insole in their shoe, I'm pretty sure they wouldn't have been moving as well. And I'm not a neurologist. And it just, a lot of times, I'm sure you've had it happen 100 times more than I ever have, or 1,000 times more. You just get squashed right away. Said, nah, it just can't be. It's a gimmick. You're trying to take people's money. No, this is the kind of stuff we need. Even, I don't know if you know the Harvard professor, John Rady, who wrote the book like Spark and Go Wild. Mm-hmm. I just talked with him yesterday, just a phone call. Big proponent of barefoot training because of all the things that you said. It's the same thing. It's like I can't say this. I don't know if he's not a functional movement specialist or anything like that, but certainly when it comes to waking up the brain and things like that, there's an understanding from some pretty prominent people out there, and I just want to see all this come together. It's Carl's delusion to help the world.
Yeah, no, but I mean, the more people that we have having this conversation and making the impact with, the professionals that you teach them that do it with their clients, it's a trickle-down effect. And then the more content on the internet and the more that people know that they can kind of empower themselves, which is why I also want to write the book, is that I think there is this freedom of knowledge that is accessible with the internet, and that people should be able to. And that's why there's all these potentially controversial things that people can do, like ozone. Like I posted something and people thought I was like giving myself an embolism because I'm putting air in my veins, which is, so of course they were hating on me, but I'm like, everyone has every right to try different modalities and look at the research and make educated decisions. Don't do, this unintelligently, but look at the research. You qualify for yourself. You make the decision for yourself, right? It would be my opinion as a doctor if I said that ozone is crap, or stem cells. I do a ton of stem cells in my office.
Okay.
That a patient will come in and I'll go over what stem cells are, what they do, the efficacy, my track record. I've been doing them for years. I have a 90% success rate. And then they're just like, I don't know, let me ask my internist. And I was like, don't ask your internist, because if your internist doesn't do stem cells, and they probably don't understand it. So of course they go ask their internist, and the internist says, those are not FDA approved. There's not enough research. It doesn't work. Don't do that. Don't waste your money. So you have to pre-qualify your source. And then if someone doesn't understand the in-depth process of something, then they're going to come to a conclusion that's based off of, I don't want to say ignorance, but lack of qualification in a sense. And that's just human nature. So I try to take that into understanding if anyone tries to attack anything that I say or use with a patient, that it's just based off of their lack of knowledge of something versus...
Exactly. Yeah, and that's a great way to look at it too. I'm just curious, would you be able to give or mind giving an example of where and how you use a stem cell?
Yes. Yep. I do amniotic and umbilical cord based injections in my office. The amniotic that's placental. So the placental lining, and then umbilical cord. The umbilical cord matrix has shown to have a little bit higher efficacy as far as mesenchymal stem cells and things like that. But I have very high success rate off of placental-based ones as well. And then there's bone marrow, and there's adipose, and then there's PRP. So classic PRP is the first one that people think of, where you draw the blood, spin it down, re-inject the platelets. That has a growth factor stem cell effect. I don't do that anymore in my office. I do the placental, umbilical cord. I don't do adipose or bone marrow because you have to get those out of the person's body. So it's a procedure before the procedure.
Okay.
Just a little bit out of scope for me and my license of where I would get those, which is why I do the other ones. But an example is I do them in plantar fascial tears. So if you have chronic degeneration of your plantar fascia, and maybe you have partial tears of the fascia, you can inject the stem cells. I have a very specific protocol after, and you stimulate the fibroblast, which creates the collagen, which repairs the tear.
Oh, wow.
It's also anti-fibrolytic, so it breaks up some of the scar tissue or the hot mess that's there, to reorganize what's called neovascularization. So when we have an injury, maybe we injure the plantar fascia or a tendon or whatever it is, you get repair of the injury, but it's like this. It's like a haystack. Like the blood vessels are messy, the fibers are messy, the collagen is messy, and then you have to reorganize it so that you get proper tensile strength and things like that out of the tissue. That's what stem cells have help to do, is to reorganize and stimulate the repair process. I don't use stem cells for arthritis in the foot because it doesn't have as high of an efficacy. There's a lot of research around stem cells for the knee. Those work really well.
Okay, good.
But the way that joints in the foot go through force is very different than knees. Yeah.
Okay, that makes sense. I hear you. Oh, now I see you, and you're moving. You're not frozen. Okay. Yeah, I don't know what's happened with the internet here, but once in a while, funny things happen on Zoom. Very interesting about the stem cells. So all this time I have known you, I actually didn't know you do that. That's really cool. That's good. So if people want to learn about EBFA courses, they want to learn about Naboso, what's the best place or places for them to go?
So for my education, it is ebfaglobal.com, and then that links to every other avenue you could go under EBFA. For Naboso is nabosotechnology.com, so Naboso Technology. And then for my medical practice, if anyone wants to see how I practice, it's just my name, so dremilysplichal.com.
I'll put links to all these on the screen too.
Okay.
So, yep, good. Well, this has been great, man. It's good to see you again. It's been a long time, too long. And I'm glad your family's well. I'm glad you're doing better. You're coming out of this COVID thing, and I really appreciate you sharing your story with us, because right now, you know, we're at the height, I think, well, every day seems to be a new height of curiosity about it. Especially here, because right here we don't have that many cases. You know, we have like 500 and you have thousands and thousands. So yeah, thank you. This is very informative, and I love all the work you do. You already know that. You rock. Oh, I don't mean to promote myself, but I do want people to know that you wrote a chapter for my book, which is going to come out next month. And it's a beautiful contribution you put into my book, which I really appreciate so much. Again, thank you. And once it gets copy. Okay.
Good. Thank you all.
Thank you. So I think we're all set. Anything else you want to share?
No, I'm just doing good. It's good to see you and see you're healthy.
Oh, you know what? I want to keep you on. I'm going to end the meeting, the recording, but I want to keep you on for 1 minute to share something. So thank you, Dr. Emily. Appreciate this very much. Always a pleasure.
Thank you so much.
Thank you, watchers and listeners. We appreciate you joining us. Take this information, learn it, internalize it, and then live it. Have a great day.